Lyme disease is a serious illness caused by the bacteria Borrelia burgdorferi, primarily transmitted through tick bites. It can impact multiple body systems, including the skin, joints, nervous system, and even the heart, and its early symptoms can sometimes be hard to spot. If caught early, Lyme disease is highly treatable, but if left untreated, it can lead to chronic issues. In this video, we'll dive into the 10 key signs that could indicate you have Lyme disease and how to effectively treat it. Part 1. 10 Signs of Lyme Disease. 1. Erythema migrans rash, bullseye rash. One of the earliest and most recognizable signs of Lyme disease is the bullseye rash, which appears at the site of the tick bite. It may expand over several days, sometimes reaching up to 12 inches across. However, not everyone gets this rash. Only about 70 to 80% of cases show it. It's usually not itchy or painful, but is a red flag for Lyme disease if present. 2. Fever and chills. Like many infections, Lyme disease often begins with flu-like symptoms, including fever, chills, and body aches. If these symptoms appear after spending time in wooded or grassy areas where ticks thrive, they could indicate Lyme disease rather than a standard viral infection. 3. Fatigue. Persistent and unusual fatigue is a common symptom. People with Lyme disease often feel overwhelmingly tired, even after resting or sleeping. This fatigue can be severe, making it difficult to perform daily activities or focus on work. 4. Joint pain and swelling. Joint pain, particularly in the knees, is a common sign as Lyme disease progresses. This pain can shift between different joints and may worsen with time, leading to chronic arthritis if untreated. Joint inflammation often flares up suddenly and can be very painful. 5. Muscle aches. Muscle soreness, especially around the neck and shoulders, can be another symptom of Lyme disease. These aches may mimic common muscle strains, but usually linger longer and don't improve with typical muscle treatments. 6. Headaches and stiff neck. Lyme disease can cause intense headaches and a stiff neck, making it difficult to move your head freely. This is due to the body's inflammatory response, especially if Lyme has affected the central nervous system. 7. Heart palpitations and chest pain. Known as Lyme carditis, Lyme disease can sometimes affect the heart, causing irregular heartbeats, chest pain, or dizziness. If you experience these symptoms alongside other signs of Lyme, it's critical to seek medical attention promptly. 8. Neurological symptoms, numbness and tingling. As Lyme progresses, it can impact the nervous system, leading to symptoms like numbness or tingling, particularly in the hands and feet. Some people also experience Lyme neuropathy, which causes nerve pain that can be difficult to treat. 9. Facial palsy. Bell's palsy. Lyme disease can lead to Bell's palsy, where one side of the face becomes paralyzed or droops. It's often temporary but can be alarming and affect your ability to close one eye or smile normally. 10. Memory and concentration issues. Brain fog. Many people with Lyme disease report issues with memory, concentration, and mental clarity, often referred to as brain fog. These cognitive issues can interfere with daily life and may persist even after other symptoms have improved. Part 2. How to treat Lyme disease. If you suspect you have Lyme disease, early diagnosis and treatment are crucial. Here are some essential steps to effectively manage and treat Lyme disease. 1. See a doctor for diagnosis. Lyme disease can be diagnosed through blood tests, but it's essential to see a doctor experienced in Lyme, as early tests may not always be conclusive. Doctors often look at symptoms and recent history, including time spent in tick-prone areas. 2. Antibiotic treatment. The primary treatment for Lyme disease is antibiotics. Doxycycline is commonly prescribed, especially in early stages. Amoxicillin or cefuroxime are other options, particularly for children or pregnant women. A typical antibiotic course lasts 2 to 4 weeks, depending on severity. 3. Intravenous. 4. Antibiotics. For more advanced cases or if Lyme disease has affected the nervous system or heart, antibiotics may be required. This treatment is usually administered over a longer period, and while effective, it may carry side effects like lowered immune function. 4. Anti-inflammatory medications. To manage pain and inflammation in joints, doctors may recommend anti-inflammatory drugs like ibuprofen. These medications can help relieve symptoms but won't address the underlying infection, so they should be used alongside antibiotics. 5. Probiotics. Antibiotics can disrupt the balance of good bacteria in the gut, so taking probiotics during and after antibiotic treatment can support digestive health and help prevent other infections. 6. Physical therapy. If Lyme disease has caused long-lasting joint pain or stiffness, physical therapy can be helpful. It can improve mobility, reduce pain, and strengthen muscles around affected joints. 7. Dietary adjustments. A diet rich in anti-inflammatory foods, such as leafy greens, fatty fish, and nuts, can help reduce symptoms. Avoiding alcohol and sugar may also benefit some people by reducing inflammation and supporting immune health. 8. Herbal and complementary treatments. Some people turn to herbal treatments like Japanese knotweed, cat's claw, or andrographis for support, although more research is needed to confirm their effectiveness. Always discuss these with a healthcare provider, especially if you're on prescription medications. 9. Regular medical follow-up. Lyme disease can have lingering effects even after treatment, so follow-up visits with your healthcare provider are essential. These check-ins can help manage any recurring symptoms and monitor for possible complications. 10. Preventative measures for future protection. Preventing tick bites is crucial, especially if you live or work in tick-prone areas. Wear long sleeves, use insect repellent, and check yourself for ticks after spending time outdoors. Early removal of ticks can significantly reduce the risk of Lyme transmission. Lyme disease is a serious condition, but early detection and treatment can make a big difference. If you recognize any of the symptoms we discussed, particularly after being in wooded or grassy areas, don't hesitate to consult a healthcare provider. With the right steps, you can effectively treat Lyme disease and manage symptoms for a healthy recovery. Thank you for watching, and remember to like, share, and subscribe for more health tips and information.